Française de Développement, President and Vice-Chancellor of AKU and members of the AKU Board of Trustees, Regional Commissioner for Dar es Salaam, distinguished guests, ladies, gentlemen, and friends, Jambo and Karibu, and Ramadan Karim. Today marks the beginning of another really exciting journey for the Aga Khan Development Network as we lay the foundation stone for the Cancer Care Center at the Aga Khan Hospital, Dar es Salaam. We are grateful to Her Excellency Samia Suluhu Hassan, President of the United Republic of Tanzania, to the Ministry of Health, and to various other government authorities and for their support and cooperation in enabling us to build the Cancer Care Center at this strategically important site. We also extend our immense gratitude to Agence Française de Développement for being a critical partner on this project. Our relationship with AFD goes back many years and spans many initiatives. Their commitment and partnership have shown an incredible commitment to improving the health outcomes in East Africa, and AFD has been instrumental in our work. Thank you. This center will further enable the Aga Khan Development Network to play a pivotal role in promoting cancer care of international standards in Tanzania. Honorable Minister, your continuous support to our endeavors in the health sector is truly appreciated, and for this, we would like to convey our deepest gratitude. Thank you. We are fortunate and grateful that you performed the commencement ceremony for Phase 2 project of the Aga Khan Hospital, and today you will lay the foundation stone for the Cancer Care Center, and thank you indeed for that again. Following the completion of Aga Khan Hospital's Phase 2, Aga Khan Health Services Tanzania and Agence Française de Développement undertook a study on the prevalence of cancer in the country. This study highlighted the need to establish comprehensive cancer care services as cancer is becoming an increasing burden for public health in country. Statistics from the United Nations Cancer Research Organization, IARC, show that there are 42,000 new cases of cancer in Tanzania each year, of which 28,000 are mortalities. Almost 75% of those cases are diagnosed at stage 3 and 4. This is a major challenge and affects survival rates. Cervical cancers represent 40% of all female cancers in Tanzania, and the human papillovirus HPV vaccination programs are still in their infancies, unfortunately. Facilities are few and far between, requiring patients to travel long distances to reach facilities for cancer screening, early diagnosis, and treatment. As a result, cancer patients present themselves too often, too late. The cancer burden can be greatly reduced if there's widespread awareness for people to have routine health checkups so that the disease can be caught early on and treated easily. The findings of the study above guided the establishment of the Tanzania Comprehensive Cancer Project, a strategic public-private partnership led by the Aga Khan Health Services Tanzania, together with the government of Tanzania and Agence Française. Thanks to a 13.3 million euro loan, 10 million from Agence Française and 3.3 million from the Aga Khan Development Network, this 4-year project is an evidence-based comprehensive initiative aimed at reducing the burden of cancer, morbidity, and mortality through a strategy that focuses on the enhanced performance and expanded outreach of the TCCP partner institutions, including the Ministry of Health, the President's Office, Ocean Road Cancer Institute, Muhimbili National Hospital, Bugando Medical Center in Mwanza, and with the technical help of the Institut Curie in Paris. Today's foundation stone ceremony marks the critical project objective of enhancing comprehensive cancer care facilities in this country. The Cancer Care Center will have 2 linear accelerators to complement radiation oncology at the Ocean Road Institute. And it will work with the public health system to strengthen community cancer care practices, as well as services that are affordable, comprehensive, and stretch across the nation. It will include primary preventive services, screening, and early detection. The new center will work with government health facilities to provide welfare support to needy patients, including beneficiaries of the National Health Insurance Fund, NHIF. AKHST's continued growth over 9 decades is a strong testimony of our commitment to healthcare and development in this country. Today, AKHS facilities are known for their high level of ethical practices, innovation, and provision of quality, safe, and evidence-based care. The hub and spokes model, with 1 hospital here in Dar es Salaam and a medical center in Mwanza, and 24 outreach centers across 14 regions of the country, enables our institutions to increase access to quality health services, as well as to work closely with the government and other partners across the health spectrum. Our institutions contribute to and possibly impact the health of over 1 million people in Tanzania. Positively, we hope impact the health of 1 million people in Tanzania every year. The patient welfare program enables non-affording Tanzanians to utilize services at the Aga Khan Hospital in Dar es Salaam and in Mwanza. The program provides financial support of about Tanzania shilling 5 billion, which equates to $2.2 million annually. And this is in addition to the Tanzania shilling 24 billion, which is $10.2 million, contributed through subsidized services offered under the NHIF program. The Aga Khan Health Services has been working relentlessly to attract international grants to strengthen the health system in Tanzania, in coordination with the government of Tanzania and especially the Ministry for Health. Earlier, amongst other investments, AKHS was able to secure a US $14.7 million impact project funded by Global Affairs, not US dollars, Canadian dollars, funded by Global Affairs Canada and the Aga Khan Foundation Canada, aimed at improving access to reproductive, maternal, and newborn health in the Mwanza region between 2017 and 2021. The project made a substantive contribution towards reducing maternal and newborn mortality in the Mwanza region, reaching over 1 million beneficiaries. I thank the President's Office and the Ministry for Health for exceptional support to the Tanzania Comprehensive Cancer Care Project and for being part of this project steering committee monitoring project implementation. Without your continuous support and guidance, the project could not be successful. I would also like to thank Bugando Medical Center, Ocean Road Cancer Institute, Muhimbili National Hospital for their active participation and contributions to the success of this innovative partnership, which we believe will positively change the landscape in Tanzania for cancer prevention and treatment. Also, our special appreciation to Institut Curie for their commitment as a full partner, primarily responsible for providing technical expertise and guidance concerning the implementation of the project across the cancer care spectrum. Also, I extend my thanks and my appreciation to all cancer stakeholders, such as foundations and survivor groups, participating in the Tanzania Comprehensive Cancer Care Project. My heartfelt gratitude to all those who have been involved in planning this state-of-the-art cancer center. On a personal note, I'm so very happy to see this event happen today. I've been discussing this project as part of the wider project in Dar es Salaam and in Tanzania with my father for 20 years, and I know that he would be thrilled to be here, so thank you.
Thank you, Your Highness, Princess Sarah Aga Khan. Please welcome Ms. Stephanie Mon, Country Director, Agence Française Développement in Tanzania, to address the audience.
Honorable Ummy Mwalimu, Minister of Health of the Government of Tanzania, Your Highness, Princess Zara Aga Khan, Honorable Ambassador of the French Republic, Nabil Al-Jalawi, Dr. Gilles Valraven, Director of Aga Khan Health Services, Hami Nabil, Chairman of the Board of Directors, dear Zinat, Regional CEO of Aga Khan, dear Sisao, CEO of Aga Khan, government officials from the ministries and public hospitals, wageni waalikwa, mabibi na mabwana. On behalf of AFD, the French Development Agency, I am so pleased to be here today for laying the foundation stone for the construction of the Radiation Center of the Aga Khan Hospital in Dar es Salaam. Indeed, this is a unique opportunity to gather old friends towards another milestone in AFD and Aga Khan cooperation in the health sector in the country. This reminds me when we all gathered almost 2 years ago in March 2019 for the inauguration of the phase 2 of the Aga Khan Hospital, also financed by AFD. As some of you may already know, AFD, as the central actor of France's development aid policy, support projects that improve the everyday lives of population in developing and emerging countries. The recent official visit of Her Excellency President Samia Suluhu Hassan in France last month to hold meetings with President Macron is a testimony of the confidence and partnership between our two countries. During this visit, 250 million euro of financings were signed by AFD with the government of Tanzania for development projects in transport and agriculture, bringing the total portfolio of projects signed for the betterment of the people of Tanzania to 1 billion euro. It is also a pride to continue to work in close partnership and trust with the Aga Khan Development Network. I really feel privileged at AFD to be part of this TCCP project and having been able to commit more than 75% of the project cost, thus a 10 million euro contribution through grant. Access to basic services is a priority issue in developing countries, despite the progress made in the last 10 years. To meet these challenges, AFD has made healthcare and social protection a core commitment, with an average of 550 million euros of funds committed each year. And in the East Africa region alone, AFD has provided more than $120 million financing in the healthcare sector with the Aga Khan Health Services, out of which $70 million, 60% of these funds in Tanzania alone, through several projects. The first one, we talked about it, is the expansion of the Dar Hospital and development of 25 new outreach centers across Tanzania. Among the key centers developed is Mwanza Primary Care Center, for which we had the privilege to conduct a site visit last month, and new centers to be established in the Dodoma region and Zanzibar Island. Secondly, there was also support to the fight against COVID-19, which enabled to construct a field hospital in Mwanza and procure needed equipment such as oxygen therapy machines, cylinders, and PPEs to both Aga Khan and its partners' public hospital in Nyamagana district in Mwanza. And finally, this TCCP project, which is implemented both by public and private players in line with the government objectives and concern derived from the Tanzanian Strategic Plan for Prevention and Control of Non-Communicable Disease and the National Cancer Control Strategy, which were adopted from the 2030 Agenda for Sustainable Development Goals by the Ministry of Health. In addition to providing much-needed critical care for this project, Aga Khan Hospital has also taken very strong social and financial commitments through care subsidization, for instance, which have been very decisive in AFD's decision to participate in the financing of the project. It is therefore a great honor for AFD to witness here today the laying of the foundation stone of the Radiation Center in the famous Plot 5 of the project. with the best qualified public and private partners around the table, Ocean World, Bugando Medical Center, the French Institut Curie, which is the world-class leader in oncology research and treatment, and which is provided technical expertise and training to build capacity of staff in the full spectrum of cancer. I am really confident that this TCCP project will reach the expected desired impact for populations, which includes, among others, a better screening with a target of reaching out 1.7 million patients. It is anticipated that the number of patients already screened would increase drastically once a mobile screening van is deployed in the outreach areas of Dar es Salaam and Mwanza. Also, a better prevention of cancer prevalence. The project should contribute to increase the number of patients diagnosed at early stage from 20 to 50% of patients affected by tumors. And also, a capacity building of at least 100 cancer care providers to reach also to over 500 community members and stakeholders in order to increase the cancer-related knowledge and awareness among the population. So I would like to thank the government of Tanzania with a specific appreciation to the Ministry of Health for the continued support to this project. To the Aga Khan Health Services, we trust that you will deploy the French resources allocated in the most effective manner with the objective to serve Tanzanians in improving their everyday life. Thank you very much. Asanteni sana.
Thank you, Ms. Stephanie Moon. It gives us immense pleasure in inviting our respected chief guest, Honorable Ummy Mwalimu, to address this distinguished gathering. May we request Honorable Amos Makala, Regional Commissioner of Dar es Salaam, to introduce our respected chief guest. Honorable Makala hajaja.
Assalamu alaikum. Bwana Yesu asifiwe. To put it clear, I'm not Honorable Amos Makala. I'm Dr. Ifero Edson Sichalo, the Chief Medical Officer, and I'm standing here on behalf of the Permanent Secretary, Minister of Health, Professor Aberi Makubi. Honorable Ummy Ali Mwalimu, Member of Parliament and the Minister of Health, United Republic of Tanzania, Princess Zahra Aga Khan, the Chair of the Executive Committee of the Aga Khan Health Services, Dr. Chande, the former Chief Justice, and a member of the Aga Khan University, Honorable Suleiman Shahabuddin, the President and Vice Chancellor Aga Khan University, Dr. Gibbs, Director of Health and the Aga Khan Development Network, Honorable Jabil, a French Ambassador to Tanzania, Dr. Zanet, the Regional Chief Executive Officer of Aga Khan Health Services East Africa, Mrs. Stephanie, the representative of the French Development Agency, AFD, Tanzania, Dr. Grace Magembe, the Deputy Permanent Secretary of Health from Pure Raj, Regional Medical Officer of Dar es Salaam, Dr. Rashid Mfaume, Executive Directors from national region and institutions who are here with us, development partners, representatives of various organizations and institutions, leaders of religious institutions, invited guests, ladies and gentlemen, and all protocol observed. I greet again in the name of the United Republic of Tanzania. Honorable Minister, it is an immense pleasure to welcome you to give a speech in this historical day with regard to cancer control in the country. It is historical because of its kind, because of its collaborative project between the private and the public institution to address the challenge of cancer in the country. Honorable Minister, we know you are passionate in cancer control initiative, especially reproductive cancers. So with this opportunity, and Giti Hannah, I welcome you to speak before this audience. Welcome and thank you.
Thank you very much, Chief Medical Officer, Professor Sichwale. Princess Zahra Aga Khan, the head of the Social Welfare Committee at the Aga Khan Development Network. Justice Othman Chande, former Chief Justice of Tanzania and member of the Aga Khan University. His Excellency Nabil Hailawi, French Ambassador to Tanzania. Dr. Sichwale, Chief Medical Officer of Tanzania. Dr. Gracie Magembe, Deputy Permanent Secretary, responsible for Health, President Office, Regional Administration and Local Government. Mr. Suleiman Shahabuddini, President and Deputy Vice Chancellor, Aga Khan University. Dr. Gig Wolraven, Director of Health, the Aga Khan Development Network. Dr. Zinat Suleiman, Regional Chief Executive Officer of Aga Khan Health Services, East Africa. Ms. Stephanie, representative of the French Development Agency, AFD Tanzania. Representative of the Dar es Salaam Regional Commissioner, Dr. Rashid, Dar es Salaam Regional Medical Officer, heads of public institutions, development partners, directors from the Ministry of Health, President Office, executive directors from various government and private health institutions in Tanzania, representative of religious institutions, invited guests, ladies and gentlemen, na wasalimu kwa jina la Jamhuri ya Muungano wa Tanzania. First, let me start by thanking God for giving us good health and enabling us to be here and participate in this important event of laying the foundation stone for the construction of the Cancer Care Center at the Aga Khan Hospital, Dar es Salaam. In particular, I would like to express on behalf of Her Excellency Samia Suluhu Hassan, President of the United Republic of Tanzania, our congratulations and appreciations for the construction of the modern Cancer Care Center here in Dar es Salaam. Hongereni sana, Aga Khan Hospital in Dar es Salaam. But I would also like to thank you very much for the briefing and the insightful information about the Tanzania Comprehensive Cancer Project. We have been told it is a PPP project, which is going to be implemented by Aga Khan Hospital in collaboration with the Ministry of Health, P.O. Large, Muhimbili Uni Hospitals, and our Ocean Road Hospital and Bugando Hospitals. So I think this is a very good model of a PPP project in the health sector, and I would like to encourage other partners to take this as an example of a good collaboration between government and private sector in improving access to quality of healthcare services for Tanzanians. Hongereni sana wote ambao mmebuni mradi huu. Ladies and gentlemen, we have been told, or we all know that non-communicable diseases, including cancer, affect us all. Cancer is a disease that affects people of all ages and genders, children, adults, men to women. We all know people whose life have been cut short by cancer here in Tanzania and outside Tanzania. Furthermore, it also causes significant losses to the nation because the disease reduces the workforce and slows down the development of the individual and the nation. It also results in family dependency and increasing the burden on the health system as it is a chronic disease and consumes many resources. Statistics from the International Agency for Research on Cancer and the World Health Organization for 2020, for example, show that an estimated 19.3 million new cancer patients worldwide each year. Of these, more than 10 million, about 50% of the new cases, about 50% of the patients die from cancer each year. In addition, out of 5 people, 1 person is diagnosed with cancer, and out of 8 people, 1 dies from the disease. Here in Tanzania, according to International Agency for Research on Cancer, Tanzania has an incidence of 76 cancer patients per 100,000 population per annum, equivalent to 42,000 new cancer cases each year. And approximately 29,000 patients, equivalent to 68% dies each year because of cancer. This is mainly attributed by the late diagnosis and inadequate number of facilities to provide or to cater for cancer treatment and palliative care. The National Population-Based Cancer Registry has registered, for example, 12,000 new cases, which is almost 28% of the expected number of new cases per annum for the year 2020. This means further effort is needed to capture all cases. According to the National Registry, Eastern Zone has the highest number of the registered cases, about 7,381, followed by Northern Zone, 2,783 cases, Lake Zone, 1,098 cases, and other zones in Tanzania combined, making the remaining 13% of the new cases, of the registered cases. These statistics are alarming, high, and as a country, we need to make immediate measures to control the situation. Strengthening health, education, health screening and treatment is key for the control of cancers in Tanzania. Ladies and gentlemen, I'm aware that on March 11, 2022, the Ministry of Health partnered with Aga Khan Hospital here in Dar es Salaam in the official launch of the Tanzania Comprehensive Cancer Project. One of the project goals, as we have been informed, is the improvement of cancer care infrastructure and treatment facilities in Tanzania. Recognizing the importance of this cancer project, the government of Tanzania will give all the necessary support to make sure that its citizens can easily access these much needed services. Availability of these services here at the Aga Khan Hospital will reduce patients' congestion at our Ocean Road Cancer Institute. We have been informed here this center is expected to treat about 120 patients per day. Currently at Ocean Road Cancer Institute, they see about 800 to 900 patients per day. So you can see the importance of this center. It's also going to reduce congestion at the Ocean Road Cancer Institute. Of course, the good news, Princess Zahra, I'm very pleased to hear that this center will also provide services to about 35% of cancer patients who will not be able to afford medical treatment, will be offered welfare support. We would like to encourage this arrangement to be implemented, and I would like to thank you very much for taking into consideration of the Tanzanian, especially from low-income household, to have access to high-quality cancer services at the Aga Khan Hospital. This is a good thing, and I congratulate you very much. Asanteni sana. Ladies and gentlemen, I understand that Tanzania has shortage of radiation equipment, especially LINAC machines. So far in Tanzania, with a population of about 60 million people, we have 7 radiation treatment machines. 4 are located at Ocean Road Cancer Institute, 1 at Besta, one at a Good Samaritan Hospital in Ifakara, Morogoro, and one is in Bugando Zonal Referral Hospital in Mwanza. I'm told that Tanzania Comprehensive Cancer Center will add 2, if we've been told here, will add 2 radiation treatment machines, thus increasing number of radiation treatment machines in the country to 9 machines, that increasing access to cancer radiation treatment in Tanzania. It is my hope that these machines will be merged with all machines in other hospitals in Tanzania, so that should one of them break down, as we usually observed at our Ocean Road Cancer Institute, then patients can easily be transferred and treated in other hospitals. In addition, these services will reduce the number of patients traveling abroad for cancer services, and it will make Tanzania a hub for premier cancer care and medical tourism. All of these show that our government is determined to fight cancer, but also by also enabling private hospitals to provide such services. And since the Aga Khan Hospital is going to add 2 radiation machines at our Ocean Road Cancer Institute, we are installing a PET scan machine. So we are looking forward to see complementarity between the Aga Khan Hospital and our Ocean Road Cancer Institute and other cancer centers in Tanzania. However, my humble request to the Aga Khan Hospital here is also to invest on improving or enhancing access to screening services for early detection. As a Minister of Health, it is really very, very painful to see that 80% of patients who attend or visit our Ocean Road Cancer Institute, they go there while the cancer is at stage 3 or stage 4. Then they make it treatment very difficult. And so we would also like to request the Aga Khan Hospital and other partners also to collaborate with the government of Tanzania to enhance access to screening services for early detection, not only for cancer, but also for other non-communicable diseases, for example, diabetes. Ladies and gentlemen, I would also like to recognize that Aga Khan, maybe before talking about this, the government will also continue to ensure or to reach out to various girls in Tanzania to have HPV vaccine. We launched it in 2017, 2018, but because of COVID-19, the number has gone down because of the supply side of the HPV vaccine in Tanzania. So we do also believe that improving access to HPV vaccine to young girls in Tanzania will also help us to reduce the burden of cancer disease in Tanzania. Ladies and gentlemen, I would like to recognize that Aga Khan Health Services Tanzania has been working in close collaboration with the Ministry of Health for many years and has had enormous contribution on health system strengthening, particularly around quality health service delivery and effective and efficient programming in health, maternal, child and newborn health, quality and accreditation, capacity building, and now on cancer care being the good example. The Ministry of Health highly supports this project, which provides unique opportunity for improving access to cancer care, especially for high-end treatment and training of health professionals. And we believe that partners and communities will respond positively to this project. The government appreciates Aga Khan Health Services' integrated approach of service delivery and collaborations in building capacities of public and private health services providers on cancer. Ladies and gentlemen, before concluding this speech, on behalf of the government of the United Republic of Tanzania and Her Excellency Samia Suluhu Hassan, the President of the United Republic of Tanzania, I would like to thank various stakeholders and donors who have made this project possible, including the French Development Agency, AFD. Thank you very much, Stephanie, for the contribution, and the Aga Khan Foundation. But also, Princess Zahara, we thank you very much for your active participation to make this project a reality today. I know cancer, you are so much concerned to make sure Tanzanians, especially women, men, have access to cancer, for quality cancer treatment, access to quality cancer services in Tanzania. So with due respect, I would also like to extend my sincere congratulations and appreciation to His Highness Aga Khan for giving priority to cancer and for ongoing support to Tanzania in improving health care. Kindly send our warm appreciation to His Highness Aga Khan. Finally, I would like to acknowledge the role and importance of the media in our joint efforts to educate the public about cancer, to educate and how the sixth-term government is improving medical services in the country. I urge you to inform Tanzanians about the importance of screening of cancer and other communicable diseases as soon as possible in order to reduce the burden of disease. And with that said, I would like to officially announce that before I say this, waandishi wa habari, kwa niaba ya Rais Samia Suluhu Hassan, ni furaha kwa serikali ya Jamhuri ya Muungano wa Tanzania kushirikiana na Aga Khan Development Network au Aga Khan Hospitali kuweka jiwe la msingi la kituo cha matibabu ya saratani, na mradi huu utatekelezwa kwa ubia kati ya Aga Khan Hospital na hospitali nyingine ikiwemo hospitali ya Muhimbili, Ocean Road Cancer Institute, hospitali ya Bugando, pamoja na hospitali nyingine katika mkoa wa Dar es Salaam na Mwanza. Na mradi huu kama tulivyoelezwa unakusudia kuwafikia Watanzania takriban 1,700,000, na kubwa ambalo tunalipongeza kama serikali ni uamuzi wa taasisi hii ya Aga Khan kusaidia kuwekeza katika upatikanaji wa matibabu ya kisasa ya mionzi lakini pia kutakuwa na huduma za matibabu ya majitiba chemotherapy katika hospitali hii ya Aga Khan. Kama nilivyosema, Tanzania tunakadiriwa kuwa na wagonjwa wapya wa saratani 42,000 kila mwaka, na kati ya hao wagonjwa 29 au 68% wanafariki kila mwaka. Kwa hiyo katika kila wagonjwa 100 wa saratani, wagonjwa 68 hufariki. Lakini changamoto kubwa ya kuwa na vifo vingi vya saratani ni kwa sababu watu wanachelewa kufika hospitali kuweza kugundulika kuwa wana saratani. Kwa hiyo kama serikali tunafurahi kuona wenzetu wa Aga Khan Hospital wanashirikiana nasi katika kuhakikisha tutaongeza huduma za vipimo na matibabu kwa wagonjwa wa saratani, lakini kubwa tutapunguza mzigo katika hospitali yetu ya matibabu ya saratani ya Ocean Road. Kubwa ambalo nimelisisitiza ni kwa hospitali ya Aga Khan na hospitali nyingine na wadau wengine kushirikiana na serikali katika kuimarisha huduma za uchunguzi wa saratani ili watu waweze kugundua mapema kama wana saratani. Saratani inatibika ikigundulika mapema, na nimeeleza pale katika kila wagonjwa 80 wanaofika, kati ya wagonjwa 100 wanaofika Ocean Road wanafika saratani ikiwa hatua ya 3 au hatua ya 4. Kwa hiyo tayari ugonjwa unakuwa umeshakuwa umefika katika hali ya juu, ni hali ya juu, umeshakuwa ugonjwa sana. Kwa hiyo na matibabu yanakuwa magumu. Kwa hiyo nitoe wito pia kwa Watanzania, ukiona na hili amelisisitiza pia Princess Zahara, kujenga utamaduni wa kupima au wa kufanya uchunguzi wa afya mara kwa mara, ikiwemo kufanya uchunguzi wa ugonjwa wa saratani, kwa sababu ukigundulika mapema unaweza kupona na matibabu au kuyafanya mazuri. Nimalize kwamba nimewashukuru Nimewashukuru wadau ikiwemo French Development Agency na Aga Khan Foundation pamoja na Aga Khan Hospital kwa kuwekeza katika kuimarisha upatikanaji wa huduma bora za matibabu ya saratani. With that said, I would like to officially announce that I'm now ready to lay the foundation stone for constructing the Cancer Care Center here at the Aga Khan Hospital in Dar es Salaam. Thank you for your attention. Asanteni sana kwa kunisikiliza.
Ladies and gentlemen, this is the
Ni furaha kwetu serikali ya Jamhuri ya Muungano wa Tanzania, hususan Wizara ya Afya, kuona kwamba tunaanza kutekeleza au tunatekeleza mradi wa ubia kwa ajili ya kuimarisha huduma za matibabu ya saratani nchini Tanzania. Kwa hiyo leo pamoja na Princess Zahara tumeweka jiwe la msingi la ujenzi wa kituo cha matibabu ya saratani, na ni kituo cha kisasa ambacho kitasaidiana au kitatekeleza majukumu yake kupitia mradi huu wa ubia kati ya serikali pamoja na taasisi ya au hospitali ya Aga Khan. Nimeeleza mzigo wa ugonjwa wa saratani nchini Tanzania. Tunakadiriwa kuwa na wagonjwa wapya kila mwaka kama 42,000, na katika hao wagonjwa wapya 42,000, katika wagonjwa 100, wagonjwa 80, takribani 68, takribani wagonjwa 68 hufariki kutokana na kuugua saratani. Mwasalage, niko sawa? Yes, 68%. Nimesema mzigo wa ugonjwa wa saratani nchini Tanzania, tuna wagonjwa wapya takribani 42,000 kwa mwaka, na kati hao 68% ya wagonjwa hufariki kila mwaka nchini Tanzania kutokana na ugonjwa wa saratani. Moja ya sababu ni upatikanaji wa huduma za kupima na matibabu ya saratani. Kwa hiyo kama serikali ya awamu ya 6 chini ya Rais Samia Suluhu Hassan, mradi huu utatusaidia kuwafikia Watanzania wengi kupata huduma za kupima pamoja na matibabu ya saratani. Na kituo hiki, ataeleza daktari hapa,
kinataraji kuhudumia wagonjwa kama 120 kwa siku. Pale Ocean Road tunaona wagonjwa kati ya 800 mpaka 900. Kwa hiyo sio kwamba tu tutaboresha huduma kupatikana, lakini pia tutaipunguzia mzigo au kuondoa msongamano wa wagonjwa katika hospitali yetu ya saratani ya Ocean Road. Ujumbe wangu kwa Watanzania ni kujitokeza mapema au kuwa na utamaduni wa kupima, kufanya uchunguzi wa afya zao mara kwa mara, ikiwemo ugonjwa wa saratani. Nimeeleza pale, naumia sana kama waziri wa afya ninapoona takwimu katika kila watu 80 kati ya 100 ambao wanakwenda Ocean Road pale wakiwa wagonjwa wa saratani. Saratani tayari iko katika hatua ya 3 au hatua ya 4. Yaani saratani imeshafika, si kwa Kiswahili nisemeje, hatua ya juu kabisa. Kwa hiyo inafanya hata matibabu yasiwe na ufanisi mzuri. Kwa hiyo nitoe wito kwa Watanzania kujenga utamaduni wa kuchunguza afya zao mara kwa mara, na saratani zinazoongoza nchini Tanzania ni 3. Kuna hii saratani ya mlango wa kizazi ambayo inawakumba wanawake, kuna saratani ya matiti, lakini pia kuna saratani ya tezi dume. Mimi nadhani niishie hapo. Kwa hiyo ni kwa niaba ya serikali ya awamu ya 6 tunawashukuru sana Aga Khan Development Network pamoja na serikali ya Ufaransa kupitia Benki ya Maendeleo ya Ufaransa na hospitali ya Aga Khan kwa kuanzisha na kufadhili mradi huu. Wizara ya Afya kwa kushirikiana na ofisi ya Rais TAMISEMI tumeahidi kwamba tutawapa ushirikiano kuhakikisha mradi huu unatekelezwa. Sasa msiniulize maswali kama hapa kutakuwa na kipimo cha kupima tezi dume kile cha zamani au cha kisasa. Lakini tusiogope kupima saratani, aina yoyote ya kipimo, kwa sababu tunasema kinga ni bora kuliko tiba.
Ni vizuri sana umesema wote.
Karibu.
Labda kitu kimoja tu in addition. Na hii ni
asogea hapa karibu hapa.
Labda kitu kimoja tu in addition kama waziri amesema. Na ni hii kama tunaweka hapa equipment na instruments kufanya matibabu ya saratani, lakini ni tofauti kidogo na Ocean Road. Ni complementary.
Yes.
Tutaendelea kusaidia each other. Na hii ni important sana kama tunaendelea. Kama unaona Tanzania ina mashine ya radiotherapy 7 tu. Sasa hivi itakuwa 9 baada ya hii project. Haitoshi, tunafahamu. Na kwa sababu ya hii pia ni vizuri sana kama watu watafika mapema sana. Kama hutahitaji hii advanced treatment. Na kama unafanya zaidi na zaidi prevention. Kwa sababu ya saratani sio kitu huwezi kupona. Unaweza kupona kama unafika mapema. Na hii ni lazima unafanya sana. Na hii ni message important sana kwa watu wote. Na kama wanasema pia, hii Tanzania Cancer Care Project ina special attention kwa journalists. Na hii attention kwa journalists kwa sababu tunahitaji msaada ya nyinyi wote kufanya hii messaging kuhusu saratani. Kama unaweza kupona kama unafika mapema na hii ugonjwa.
Kuna maswali labda?
Ningeomba tu
labda kubwa ambalo katika mradi huu tunautekeleza, kuna jambo moja kubwa zuri. Tutatoa pia huduma kwa Watanzania wa kutoka kipato cha chini kama 10% mpaka 35%. Kwa hiyo wanaweza wakasaidiwa kupata hizo huduma za matibabu. Lakini kwa upande mwingine pia serikali inaendelea na michakato. Nadhani neno la michakato linaweza likawa baya, lakini ndio hilo la kuhakikisha kwamba tunakuja sasa na ile sheria ya bima ya afya ya kila mtu ambayo itatusaidia pia kuhakikisha Watanzania wanapata huduma za matibabu bila ya kikwazo cha fedha. Sasa hivi nataka nikiri, ni kweli Watanzania wengi ingawa tunasema matibabu ya saratani ni bure katika taasisi yetu ya Ocean Road, lakini kuna baadhi ya huduma inabidi watu wachangie.
Sala mwisho. ni sehemu ya mradi huu. Si kweli? Ipo katika maybe please chukueni maneno machache kwa balozi. Mheshimiwa balozi,
few words about historically 100 years ago of this treatment by radiation, and it's the most prestigious institute in France and probably in the world. And the idea is to bring this kind of treatment, this kind of technology, this kind of expertise here to the patients in Tanzania, not only in Dar es Salaam, but also in all the country, thanks to the cooperation we've had with the Ministry of Health here, thanks to the cooperation we are carrying with the Aga Khan network through all the country and also through all the region, East African region. We have participated by funding this project, 10 million euros, and by also adding this scientific and academic expertise. Now the teams are communicating between Institute Curie in Paris and also the hospital here. We hope that this project will be very soon ready to provide all the services to the population. And let me add one thing. It is very important for the two countries at a high level to continue this cooperation in health. When President Samia Hassan was in Paris mid-February, a month and so ago, in her meeting with President Macron, they mentioned the cooperation in health, and there's a strong commitment from the two leaders to continue this cooperation, and we rely on our trustful partners here, the Aga Khan and the Ministry, to continue this. And it's mostly about also providing development in all the country and also women empowerment, because what we see is that it is mainly women, breast cancer, etc. It's a real issue, and we are very keen to continue this. And thank you for this cooperation, Minister and Princess Sarah.
kuwezesha wanawake kuwaepusha na magonjwa. Kwa hiyo kubwa ni lile nililolisema. Tumesema tunakadiriwa kuwa na wagonjwa 42,000 kwa mwaka, lakini wanaofika katika hospitali zetu zote Ocean Road, Bugando, Muhimbili ni wagonjwa kama 12,000. Kwa wagonjwa 100 wanaofika hospitali wagonjwa kama 28. Kwa wagonjwa wa saratani, waandishi wa habari mtusaidie kuwahimiza watu wanaona dalili. Usikae nyumbani au kakimbilia kwa mganga wa kienyeji wakati una saratani. Nendeni hospitali, amesema vizuri daktari, saratani inatibika ikigunduliwa mapema. Sasa Watanzania wengi tunakaa nyumbani, tunaumwa, unasema uchawi, nimelogwa, kumbe ni saratani. Kwa hiyo nitoe wito kwa wananchi, ukiona dalili kwenda hospitali kupata vipimo na matibabu. Asante balozi.